IPSO is an international society of surgeons specialized in the surgical care of children with cancer. It's a truly global organization with an expanding membership from all over the world. And we have the aim of improving the surgical care of children with cancer globally. These guidelines represent the most recent guidelines in pediatric surgical oncology, but they are not only devoted for hospitals and countries that have all resources, but they have also been adopted for implementation in resource-limited settings or low and middle-income countries. These guidelines represent a very, very inclusive document with over 400 pages from 84 contributing authors from around the world. IPSO selected a lead author from a high-income country and one from a low and middle-income country that were assigned for each topic. Then we released an open call within the IPSO community, and contributors built each topic and submitted it for validation at the executive committee and the education committee on IPSO, which contained one representative from each continent. So with the guidance of our secretary, Chan-Hon Chui, and the great work of Ted Breschel, Simona Bibb, Sharon Cox, and the rest of the IPSO team and committees, this document was developed extensively with the aim to benefit children with cancer across the globe. They do represent the most recent guideline for pediatric surgical oncology published, but not only for hospitals at high-income countries, but they have been adapted for implementation in resource-limited settings and low and middle-income countries, which is their specific and special value. It has been proven that outcomes for children with cancer differ greatly between high-income and low and middle-income countries, and that has many reasons: access to care, infrastructure, trained personnel. So not always the regularly published guidelines are able to be applied in the resource-limited settings for obvious reasons. So we have placed a particular interest on making recommendations on how to improve the surgical outcomes of children with cancer in these settings, making adaptations and explaining how these guidelines could be applied without so many resources. The guidelines are important because childhood cancer has become a global conundrum. It's a public health challenge. It does represent the leading cause of death between 5 and 14 years of age worldwide, and there's an increased incidence expected to continue for over the next 30 years. It has been projected that between 2020 and 2050, nearly 14 million children will be diagnosed with cancer around the world. And without further intervention, since most of these kids live in low and middle income countries, it is expected that over 11 million children will die to cancer over the next 30 years. So it is most imperative that implementation of actions can be applied in the low and middle income setting in order to avoid these deaths. On behalf of the International Society of Pediatric Surgical Oncology, we kindly invite you to read and review these guidelines that represent the most recent coverage for improving the care of children with cancer requiring surgery.